we can help them set their hotel rooms. At our clinic, we're gonna do a clinical exam and we're gonna do the final treatment plan. This is a CT scan. It allows us to take panoramic x-rays.
Meet Dr. Simon and his team, who'll give you all the right reasons why San Jose is the place for your dream smile.
When the patient comes into the country, we can help them set their hotel rooms, give the service of picking the patient up from the airport and dropping them back to the airport. Here in the clinic, we're gonna give them all the support that they need from a medical point of view. What we do is, before the patient comes, if they have some x-rays or some treatment already done by a dentist back home, we ask them to send it to us so we have a better idea and understanding of the patient's needs. With that, we are able to provide an estimate of the treatment, and when the patient actually arrives, we're going to take new x-rays and pictures at our clinic. We're going to do a clinical exam and we're gonna do the final treatment plan. Once the patient agrees on that treatment, we'll go right away and start working on the treatment. If it's just crowns or veneers over natural teeth, on the first day what we will do is grind the teeth, make impressions, send that to our lab. Usually, depending on the amount of crowns, either 3 or 5 days later, we're gonna have a drying, that is a plastic teeth that we can put over the patient so they can see how their final restoration is going to end up looking. They can request if they need any changes, and from a professional view, we can see that we're going through where we want, that the teeth are aligned correctly and that the bite is in the right position. Once it's approved, then we will make it into zirconia, and 3 to 4 days later, we will be cementing the crown. So usually treatment that is over natural teeth, in a week and a half, we can complete it. If we're doing implants, then what we will do in the first trip, again, is to make x-rays, pictures, clinical exam. We will see if the patient has enough bone for implants. And depending on in which type of implant treatment, we will either do the surgery on that same day, or in cases that are all on 4, almost 6, or all on 8, that are more complex and the patients are going to need to have a lot of extractions performed, what we will do on the first appointment is to take some molds to be able to fabricate dentures that we will give the patient once they are without teeth. 3 or 4 days later, the surgery is actually going to be performed, and we will deliver a denture at that point, and the patient leaves and comes back after 4 months. On the second trip, what we will do on the first appointment is to cover those implants, make impressions. 2 or 3 days later, we will do a trying in plastic, and 3 or 4 days later, we will be delivering the fixed restoration to our patients.
Here at the clinic, we have all the high-end technology to restore every single case that we have with our patients. From single crowns to a full mouth restoration, we can achieve everything that the patient wants. We have 3 scanners here at the clinic. We have a 3D machine. If we need to do any changes or anything, we don't need to send it to a further lab. We have our own lab here at the clinic, so that is going to be very helpful for the patient as well.
This is a CT scan. It allows us to take panoramic x-rays, which is a 2-dimensional x-ray, and allows us as well to take a 3-dimensional x-ray. With this, when we're going to do implant, for example, we can know exactly the height, the width, and the quality of bone on each patient. So with this, we can be more precise at the time of the placement of the implants. This is the CEREC milling machine. So, for example, for an inlay or an onlay, or single crowns, we can do a digital impression with one of our scanners to a digital design of the crown that we want to fabricate. And this machine is going to mill it in a matter of minutes. So one of the advantages that we have with the CEREC system is that they can restore or fix a tooth on one appointment on the same day. So if you have a small case or you have an emergency, that's something that we can handle very well with this type of machine. For bigger cases, we require more days to fabricate, and that we do it in our own lab. Our 3D printer machines, we have three. Two of them produce models. So since we're doing it digital, we don't have a cast to work on, but we send the digital information to this 3D printer and it can produce the models in here. We have one printer to make night guards, and we have a printer in cases where we're doing implants where we can simulate the gum and it can be detached from the cast to give a much better margin and fit to the gum of the patient.
Mainly, what I do at the institute is implants. We do a lot of all-on-4, which is a very common treatment now. So we do immediate all-on-4, immediate loading, aesthetic implants, bone grafting, sinus lip bone grafting. And of course, general dentistry in the surgical part, which is wisdom teeth and extractions, impacting teeth or root tips.
Common 4 is a fixed bridge that is attached to 4 implants. The all-on-6 is a fixed bridge that is attached to 6 implants. And the 3-on-6 is 6 implants with 3 individual bridges attached to it. How do we determine which is the best option for you? It will depend in the amount of bone available and the level of the gum. If we have a lot of gum and a lot of bone, then you will be a good candidate for a 3-on-6. If you have a lot of bone but not enough height of gum to make the teeth look aesthetically, then you'll be a candidate for all-on-6. And if you don't have good enough bone in the posterior areas, in the back areas of the mouth, but you have good bone in the front and you're missing gum, then you'll be a candidate for all-on-4. So basically those are the 3 most talked about treatments nowadays, and those are the difference between them.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.